Continuation of care is one of the main patient's rights. What does it mean exactly? What should you do about it? We'll explore before some tips to help you along. Welcome, I am the Medical Bill Whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. So what is this continuation of care? It is your right as a policyholder to continue receiving a treatment or a service with the same medical provider under the same circumstances and the same rate of payment when the status of this provider changes from in to out of network. Why would it change? Either because the provider was in network but your plan changes and that provider is now out of network, or because that provider terminates their contract and becomes out of network. But most of the time, it is, again, because the provider was contracted with your plan terminating and no longer contracting with the new plan you are just becoming eligible for. What does it mean concretely? Continuation would mean that you can keep your doctor or the facility to finish a treatment or until the time when your care can be safely transferred to a new in-network provider. While this is great news from a clinical point of view, financially, it also is good for you because in-network rates paid, especially for out-of-network providers, mean a higher allowance and a higher rate of payment. In a word, you save tons of money. When does continuation of care apply? Well, it could be if your treatment cannot be delayed or safely transferred at this time. And by safely, I mean without causing any harmful or negative effect on the outcome or on your overall health, let alone life. Some examples would be you are undergoing radiation treatment, chemotherapy treatment, or even are inpatient in a mental health facility. Another reason why continuation of care may apply is because there is no equivalent available trained experienced provider within the new plan network. And even if there is one, if you cannot access that provider and cannot get an appointment within a short enough amount of time, then continuation of care applies. Another reason, the service treatment procedure is already scheduled or even authorized by your previous plan, and let alone the result of an emergency. In such cases, it might be harmful to delay a procedure, forcing your new plan to enforce continuation of care. As for legal mandates, a big one, the No Surprise Act, a federal act that came into effect a couple of years ago. It clearly states a number of problems or conditions, including pregnancy or care of a child under 3 years, or acute condition that force insurance companies or a new plan to apply continuation of care. It even says how long that continuation of care must be applied for. So if you are undergoing acute treatment or are pregnant, are institutionalized in a facility or inpatient in a hospital, or God forbid, terminally ill, then federal law applies and your current treatment can be continued with the same provider at the higher inpatient rate, even if that in-network provider with your previous plan no longer has a contract or has no contract with a new plan. How to apply for continuation of care? Well, the entity, the doctor, the person who obtained a current authorization, if there is one, must request that transfer, or the provider who is currently treating you must request a transfer. There might be a small number of providers or offices who don't have the staff or the knowledge to do so. In such cases, the member can. But providers and offices will know that they should request that transfer of an authorization or extension of an existing undergoing care with medical records that prove and support medical necessity. They should include a treatment plan as well as explain how transferring your care at this point would be harmful or unadvised. If you as a member are somehow left with the task of requesting coordination of care, authorizations, or extended benefits, just check on your new insurance portal and you will find what is called a continuation of care request form. You will need two things. First, clinical justification, again, showing that you have a current authorization and undergoing treatment, or a letter of medical necessity showing that it would be unsafe and harmful to your health to transfer your care at this time. But you also need administrative justification, especially if you have already a special or pre-authorization obtained and approved by a previous plan, or if you can demonstrate that you went over the list of in-network providers with your new plan and could not find anyone available, trained, accomplished, specialized, who could take over your care at least at this time. But do be aware that if services are not or no longer an emergency, if they are not or no longer life-threatening, and if there is even one provider listed as in-network in your new plan's directory that seem to be able to take over your treatment or perform the service, your insurance has the right to deny continuation of care requests and to offer you immediate transfer to an in-network provider or facility. And unless you file an appeal right away to try and override this type of denial, you may be forced to either switch your care right away or forced to pay that provider at the out-of-network rate or even as self-pay. Should you have to file an appeal, I have a number of videos on how to best do it. But in a word, remember, you will need to explain and justify and even prove why your transfer of care would not be recommended at this specific time. And now for some helpful tips. The first one, don't wait. If you know you will have a new plan in January, don't wait until that time when insurance companies are overwhelmed with changes of memberships and new requests for authorizations to ask for a continuation of care request. You can even start applying a few days at the end of December. And asking for an expedited request, even through the office or by yourself, could help you gain a few days, especially in cases such as chemotherapy or radiation therapy, where any delay would be unacceptable. Gather your documents, your treatment plans, your consultation reports, medical notes and records, but also authorizations that may have been issued by your previous plan, reasons for rejecting your new policies in network providers, and so on. And last but not least, try and do some due diligence by locating an in-network alternative, by transferring your care to an in-network provider as soon as you can. Go online to find a doctor or find a facility to help with that search, especially if the kind of treatment you are receiving can offer a little bit of delay or is not critical to your well-being and your health. When in doubt, ask your current doctors, is transfer of care safe or not? I thank you for watching. Your likes, comments, subscribes help support this little channel to grow, to reach out to more patients like you. So thank you.